Good afternoon. I am Louis Rickey, and I'm Executive Director of the Indiana Arts Commission. I want to welcome you to our webinar today. As you all know, the COVID-19 situation continues to evolve in our state and our nation and our world, as well as the response of government, especially here in Indiana. And so I know the situation markedly affects your work as an arts producer or presenter or artist. And therefore, I know you have a lot of questions, especially since we recently announced some other strategies from the governor's office about COVID-19. And I'm happy to have with us today our Chief Medical Officer from the Indiana State Department of Health, Dr. Lindsay Weaver. We have set this up that Dr. Weaver is going to do a brief presentation, about 20 or 25 minutes, on the situation, and leave an ample amount of time, about 25 to 30 minutes, for you all to ask questions. So welcome, Dr. Weaver. Thank you so much for spending time with us today, and I will turn it over to you.
To be here and talk to you. I shared with the team here with the Indiana Arts Commission that I am a big lover of the arts, and I'm actually going to be competing in the Indie Dancing with the Stars competition at the encouragement of my 5 daughters. But my family, this, all growing big part of my life, but I am not an artist myself, so just an appreciator, well, except for this one exception, I guess, which will be funny. So I'm going to share my screen and walk through a couple of things here with you all. Okay, so as mentioned, I am the Chief Medical Officer for the Indiana Department of Health. And I have actually only been with the Indiana Department of Health since February. So as soon as I started here, I immediately went into full coronavirus mode and have been doing so. Several questions that you guys submitted. And so I just wanted to start off my presentation by reviewing those, and I will answer them to the best of my ability throughout the presentation. So what are some best practices for patrons entering our establishment? Should we require temp checks? It's a great question. How should we approach school holiday performances? I'm a patron. What can I do if I see a venue isn't following state's guidance? What takes a county from orange to red? And do I need to reapply for exception to the max gathering mandate if we change colors? How often do county colors get changed? We're trying to plan for 2021 and aren't sure how to go about that. Why is a positivity rate an important statistic? And what's the benefit of outdoor events? Can I have more people in attendance? Is there an accessible county map information for people with color blindness? So all really great questions, and we'll go over those throughout this, plus some more. So this is our county map for cases per 100,000 residents in the past week. So this really is the more important map right now, because this really tells you how high the spread is. The county positivity makes sense when there is less spread, because anybody, as you all know, symptoms of COVID-19 are like many of the things that we have, all the time: flu, other respiratory viruses, even some of the symptoms of allergies, migraine, GI bug example. All of those fit the symptoms. And so what the positivity rate says, that of all people that potentially have the symptoms of COVID-19, or maybe feel like they could have been exposed, how many of them actually have COVID-19? But right now, if you look at this map, you can see, so red is the highest color. And I will tell you, for the colorblind question, it does say on the left exactly, what makes it the color. So if you are colorblind, I would just look to that and see, okay, 200 or more means that we'd be in the red area. And then of course 100, 109 cases. But this really shows that we are in our highest level of spread in most of the counties in Indiana right now. And then this is our map of the two between, so the and the number of cases per 100,000 combined, and same thing. So if you are an orange, that means you have an average score of 2 to 2.5. And if you are red, that means you have a high positivity rate and you have a high case per 100,000. and that's for people who have a score of 3. The little triangles represent, in those counties, a high proportion of the cases could be traced back to a specific location, whether it be a long-term care facility or the Department of Corrections, just for a couple of examples. Sometimes we've had the alert on there for our universities when they were doing massive testing. This updates every Wednesday, and is actually all the information up until the Sunday from the week before, and then so we collect all that information on a Sunday, and then the map is actually updated on Wednesday. So it really kind of gives you a look from the week before. And if you want to see what the daily changes are, I recommend you go to our website, coronavirus.in.gov, and daily changes are updated on there daily. As you know, we came out with some additional recommendations last week from the governor, specifically associated with the colors of the different counties. So in general, requirements for all Hoosiers, face coverings are still required. Businesses are open with certain requirements, looking at the color metrics, and we'll go back and I'll talk more about what those are specifically. Ask that you place clear, visible signage at public and employee entrances that face coverings are required, and businesses should only admit those who wear face coverings and practice social distancing. So customers at restaurants, bars, and nightclubs required to be seated and receiving service, and individuals from non-household parties must be spaced 6 feet apart at tables, counters, or other seating arrangements. And speaking to those establishments, I will say many of them say, because there's lots of questions about the percent capacity, which is a lot what we use in the beginning. When we talk to these establishments, they do say that their capacity, of course, is reduced and even close to the 50% range in order to get that 6 feet of distancing. So since we know that the 6 feet of distancing really is what we are looking for, that's why we have a lot of focus on the social distancing mechanisms here. And then, of course, some more information about hospitals and schools and required to maintain social distancing of 6 feet in public spaces, inside or outside. So one of the questions was, what is going on with outside? So, ventilation means a lot, whether you are inside or outside, but outside is the absolute best ventilation that you can have because you have, of course, all of the outdoors. So that's why outdoor events really are better and what we encourage more than anything, just because of the great ventilation. The wind picks up the virus as you're talking or speaking and just, moves it on. That being said, we still absolutely know of cases where people have contracted the virus at outdoor events. So if we're standing face to face and talking for a prolonged period of time, my risk probably still is a little bit lower because you're outside, but it doesn't diminish it. So if you go outside plus social distancing, that's the other nice thing about outside, right? You don't have the limits of the walls for social distancing, then those are all the best things, but doesn't make it nothing. Additionally, the Indiana Department of Homeland Security and ATC, together with local partners, will continue to check businesses for occupancy, social distancing, face covering requirements, and other executive order components. We continue to recommend people wash their hands frequently, but we really do believe that getting it from your hands is even much more of a risk. The more and more we learn about this virus, it really is the droplets, so the speaking and breathing it in, coughing, sneezing, etc. And not so much from surfaces, even though we should always be washing your hands, because the last thing you want is some other virus plus COVID-19. And then, of course, do not go to work or other locations when you feel sick or symptomatic. If you go to the coronavirus.in.gov website, you just need to find where you live, and it'll show you all the locations around you that are doing COVID testing that we are aware of. Of course, there are some that we're not, that probably aren't on the map, but all the ones that we're aware of. And if you click on that location, it'll give you additional information, such as, is it free? Are there any special requirements for getting tested there? And some of them will also even have a link to tell you about what the expected turnaround time is, what kind of tests that they do there, etc. With this high community spread, it's all the more reason why we really need to protect the people who are the most vulnerable. So those are people older than 65 and people with known high-risk medical conditions, such as obesity, asthma, COPD, diabetes, cardiovascular disease, just to name a few. And people who need to come in contact with people at high risk really need to take all precautions and really avoid even having that visit if at all possible. This is especially true as we go into the holiday season when we know everybody wants to get together. And I'm going to talk a little bit more about your specific risks when it comes to smaller gatherings. So just to go a little bit more into information about the different color coding, and this again is our map that's updated every Wednesday. The blue is, all general requirements still in effect, and the limit social gatherings, indoors or outdoors, are limited to 250 people. To have 250 or more people must submit a plan to the local health department at least 7 days in advance of the event. And those requirements are effective on November 22nd. So for yellow, so that's moderate community spread. Again, social gatherings are limited to 250 people, and you need to submit for any special seasonal or commercial event for which more than 100 people will be in attendance. Must submit a plan to the local health department at least 7 days in advance for them to review. And then, of course, just to be an increased awareness of COVID-19 in the community, discuss if there's anything that needs to be done at specific patients that could potentially be leading to the spread of the virus. When we do our contact tracing, we don't really aren't able to trace back spread of the virus specific locations, but occasionally we are, and it is often very clear how it occurred, right? Lots of people, small space, not wearing their masks. And so in some events in some places in the state, they have shut down or changed recommendations or kind of fixed that situation. So for orange, when there is increased community spread, that when more needs to be done. This really is the majority of our state right now, or a lot of part of our state is in this area. So lots of recommendations here. So social gatherings, indoors or outdoors, limited to 50 people. If you're going to have more than 50 people, that you need to request to submit a plan to the local health department at least 7 days in advance. Common areas and break rooms should be reduced, and users must be socially distanced. We also have some specific recommendations around sports here for schools. And I think for the person who asked about school performances, I would refer to that. So anything about extracurricular activities here in the orange and red recommendations, I would consider for yourself as well when it comes to school presentations, because that's an extracurricular activity for K through 12. And honestly, not the best thing to be doing, especially moderate to high community spread. And then red, further limiting social gathering sizes to 25 people. Note that both for orange and red, before you would actually change what you were doing and the expectations to expand, for example, your social gatherings or any other recommendations, that the requirements have to remain in effect until your metric has gone down for 2 weeks in a row. So we do recommend that as soon as your county goes up into this color, or not recommend, but it is stated that if your county goes up into this color, you go ahead and enact those colors, and then you don't back off until you've been in a lower color for 2 weeks. Only because once you're there, then that's a sign that things have already gotten to that point, and it takes some time to correct. And so that's why we have that recommendation. So just a little bit more information, and this is available on the coronavirus.in.gov website, and this is actually from November 11th that I pulled this data, just to show you that it's really that 20 to 29-year-old range. You can see there on the bottom graph, that is our highest percentage of cases right now. And we've heard this from the federal government as well, that their biggest worry spot is 18 to 35, just because they have such mild symptoms, and honestly, or no symptoms, and are probably the most engaged in the community and out and about. That even though they do relatively well, the risk of them spreading it to the more at-risk populations is high, and a lot has been contributed to this current spike. So I mean, just some good information to know that if you fit in that category, or someone in that category, or maybe this is the category that most frequents your establishment, or maybe it's the artist at your establishment, to have that careful conversation with them about, this is the role that you are currently playing in the outbreak, and what can you do to change your behavior so that we can have, get our case counts down, which then would get our hospitalizations and our deaths down as well. So I wanted to share with you some information, and this is on the CDC website, so you can go there to find any of this information about the coronavirus, and it's just really some good breakdown. I love these little graphs because they're case reports, but they have been studied by scientists just to give us some more information. And hold on just a second. Sorry, having a little difficulty with my PowerPoint presentation right now. Okay, going to try again. Apologize. Oh, no, that's not right either. There we go. Okay. So this one is just talking about that people often who have already been to the hospital once, that there's a higher risk that they would come to the hospital again. So it just goes to show you that there, it is a high risk that we're going to continue to see an increase in our hospitalizations here in the next couple of months, just as we've seen this increase in hospitalizations over the last several weeks. So this is some really good information about masking and the importance of masking. So I'm sure you guys heard, and I'll have a slide here in a little bit, about the two people who were doing hair and took care of 139 clients over an 8-day period, symptomatic hairstylists, and none of the clients who they saw subsequently ended up getting infected, and it's because both of them were masked. Additionally, a study of 124 households had one laboratory confirmed case of infection, and mask use decreased the rate of infection by 79%. Same thing, another study in Thailand that looked at 1,000 people interviewed as part of contact tracing, and they showed that mask use decreased the risk by 70%. So we keep on hearing that number over and over again, a decrease in 70% if you wear your mask on a regular basis. So if that is your biggest takeaway from this presentation, then I will feel like I did a good job. Additionally, some more information specifically about universal masking. So if all of us do our part and we all wear our masks, then it'll have that much even greater benefit. And again, this is all from the CDC website if you want to go there and pull any of this for yourself. And they also state that they believe that the relationship of both me and you wearing our mask actually is complementary and possibly synergistic, meaning that they are additive. So we're both protecting yourselves and the other person even more than just had you worn the mask yourself. I also want to refer you to this website. This is from Georgia Tech. And I think it's just, basically it takes how many cases per 100,000 do you have in a community? What is the population there? So about how many people are infected based on the total number of people in your population. And if you have a gathering of so many people, just kind of doing the math, what is the risk that someone there possibly has COVID? So I have not myself done this math, but this is a really good website if you're just interested and want to take a look at it. And if you would hover over Marion County right now, and you would say, 25 people at a gathering, and knowing the current spread in Marion County, it says that you have anywhere from a 50 to 75% chance that someone there has COVID. So if you're planning for Thanksgiving and your plan is to have 25 people in someone's home, you could go to this map and say, okay, this is up to a 75% chance that someone at this party or this get together will have COVID, which is really high, especially if there's someone there in a vulnerable population. Over and over again, we do trace back the spread of COVID-19 to these smaller gaps. Someone asked me specifically about numbers, and to me, it's not so much the number. And if you own a large, if you're part of a large, let's say, museum or some large retail place, and you have 25 people there, but it's over this large square footage, that risk isn't very high. It's when that you push that group of people together. So, for example, even at the Colts Stadium, right? So that's a lot of people that are going in there. We're not seeing community spread there, or we're not seeing spread of the virus there because everybody is so spread out, and they go there to be with their immediate family, or maybe their friend that's in their social bubble, and they're not interacting with other people. It's really when you have the people interacting from different units or different social bubbles or different families that you get the spread of the virus. So whatever you can do in your life or at your place of work to help keep those different groups apart, then you are doing your part in decreasing the risk of transmission. So here's an example of a wedding reception. I'm sure you've heard about this in Maine. So 30 cases out of a wedding reception that led to, in the local community, 21 death. There was someone there from a long-term care facility, and they believe that case brought that or that wedding reception brought COVID into that long-term care facility, which led to 38 cases and 6 deaths. And then also same thing, brought the infection into a correctional facility, which led to 82 cases and no deaths. So you can see where one gathering really led to a tremendous outbreak. I will also say that we were able to trace some of our initial spread here in Indianapolis with some of our first cases back to a wedding reception. So a summer overnight school retreat. This is just, I put this up there to say that testing is really limited. I think a lot of people, we're initially planning on that, oh, we're just gonna have everybody tested, and if they all test negative before they get there, then we're good. Well, it's not true. So testing is not 100%, first of all. No test ever is, but I think people now know that more because of COVID-19. But tests are about 70% sensitive, so it missed 30% of people if they're positive. In addition, that test is only as good as it is for that moment. So I can test negative this morning and even test positive later today, especially the next day, and especially if I change my behavior thinking that I'm negative, and that therefore I'm okay to go about and potentially expose myself to other people. So in this case, the student tested negative 1 week before the retreat, but then developed symptoms and tested positive shortly after, and of course after exposing other people. And here's the tale of the 2 hairstylists with COVID-19, and it spent at least 15 minutes with 139 clients, and no clients were known to be infected. So I think that's a really important thing when people ask, should I really wear a mask? I bring up these church cases. I have one and then another one after this, because we do believe, this is people who are comfortable being around each other. We also believe it's, loud talking, singing, etc. When you are pushing your voice out, you're pushing the virus out further. And we 100% know that you can spread the virus in the 2 days before you would ever develop symptoms. So people, with the best of intentions, feeling great, but they go into these situations, not knowing that they're positive, and it really can lead to some bad outcomes. And here's specifically about a choir practice where one index case, so you can see that red square, with one symptomatic person, 87% of the group developed COVID-19. Other thing I wanted to bring up is you probably heard us talk a lot that there is vaccine on the horizon, which is really encouraging. And I think that that can help people, when you just don't know when there's an end in sight, it's hard to continue to just, really, keep to yourselves and keep doing the right thing. But I'm sure you heard that last week, Pfizer stated that they had 90% effective vaccine, and mild symptoms of fever and fatigue were the only thing reported. So no serious adverse events, which is wonderful. And then the Moderna vaccine just released today, 94.5% effective. 95 people who received placebo contracted COVID-19, and only 5 of those who received the vaccine developed COVID-19. 11 developed severe disease in those who received the placebo, and none of the people who received the vaccine developed severe disease. So that's really encouraging. Of course, we're waiting for a lot more information to come out in order to learn more about these vaccines, and we expect to get that information here in the next couple of weeks. But we are very hopeful with this initial results. This first round of vaccine is going to be going out to healthcare providers so that we can reinforce our healthcare workforce. We have lots of healthcare providers that are out on quarantine or sick right now. And so by getting the vaccine in them, then they're available to take care of people. Additionally, they're exposed to COVID-19 on a daily basis. So we need to make sure that we protect them. And they can also potentially bring COVID to their patients. So 3 really great reasons why the healthcare workforce will be our first ones vaccinated. But then after that, we're going to move to our vulnerable populations. And as long as we have vaccines that work well in those populations, so those that are older, those who live in long-term care facilities, people with comorbidities, and from there we'll move to our critical workforce infrastructure, and from there to the general population. So this first vaccine was only tried in people who are greater than 18, but they have actually moved that vaccine down and are trialing in people 12 and over. So it'll be a little bit more time until we get it into kids, but we're really hopeful with our results. And I think it's important that people start talking about it now so people understand the process of vaccines and what it means, so that they'll be more likely to get it if it works for them. All right, so I think I hit my 25 mark almost on the dot. So I think we're going to open up to questions at this time.
So Dr. Weaver, I'm going to start with a question, which is, given the fact that there are promising vaccines on the horizon and maybe an approximate time frame now towards those vaccines, how does that change a public health strategy, given that there's a point in time when vaccines might be available?
Yeah, so for the most part, it doesn't change much at all. So, even if we were to vaccinate our entire healthcare workforce, it's only 400,000 of the, I think it's 6.2 million Hoosiers. So that's, not really enough for us to be able to change what we do. And I think that's an important point. We really need to continue to be diligent with our mask wearing, our social distancing, avoiding large, gatherings of people, unless you're able to maintain that social distancing and wear your mask, et cetera, that it'll be some time before we really have that level of vaccine where we can change our behaviors in those social circumstances. So I think I've heard others say that this is probably going to be a this time next year thing, but a lot of it depends on how effective these vaccines continue to be, how many people get vaccinated, and just a lot of factors play into that.
I have a question here about that some of the guidelines for church services are different in numbers than they are for other kinds of gatherings. And I suppose there are maybe some legal issues around those, but would you like to comment on that?
Yeah, I think the most important thing is that people realize their own risks, right? And so if you are at risk, or you feel like it's an at-risk situation, that you then change your own behavior, and that's really what's going to make the biggest difference. That we can restrict, social gatherings at places down to 10, but if someone has a big house party and invites over 100 people, I mean, that's really high risk. Or the wedding in the backyard where people aren't social distancing and wearing their masks. It really does come to all of us to make sure that we are being, changing our behavior and doing what we can do to play our part.
What would you think is the best piece of advice that you can give to people, sort of just on a daily basis, as far as assessing and controlling the risk in their own lives?
Yeah, so I think that, it's been hard. It's a whole year. So there's been lots of things people have wanted to celebrate, right? Birthdays, weddings, graduations, lots of things. And I think that has been really hard, that we are a social being and we want to be together. So just trying to be creative and thinking about, how can we do things differently than we have before, that we still have that celebration, that we still find a way to have that closeness without putting each other at risk. I have had I unfortunately have talked to people who have hosted an event where people have ended up getting sick, and then even in some circumstances dying. And I can't explain to people the tremendous guilt that those people have, just questioning, like, what if I would have done something differently? And so I think that we just have to keep that in mind, that you don't know until you know, but don't put yourself into a situation so where you are that person, right, where you're questioning, could I have done something differently?
Do you believe that hospitals should go back to limiting and restricting visitation?
Again, as a physician who also trained, and I did a fellowship in palliative and end of life care. I 100% believe, that when I treat my patients, I am also treating a family, and so ways to keep people safe, but still allowing that interaction. We know that patients do better, right, when they have their family support. So, the hospitals in the state have done a great job of balancing the risks of visitation, but also acknowledging the importance of it. And they will continue to do so. I think it was hard in the beginning of this virus because we knew so little about it. But now that we know more and we know the things that we can put in place, that the hospitals will continue to have to, just try and really figure that out. And, let people know here is what the risk is for both the patient and for their family.
So as you prepare for your own creative endeavor, Dancing with the Stars, what kind of precautions are you and your partner taking, and I suppose the organizers of the event, that you would recommend?
Yeah. So my partner and I, when we practice, we are wearing masks the entire time. There's rare instances when we are within 6 feet of one another. It's just him and I practicing, and it's going to be virtual. So they're going to videotape it. And so it'll be, and of course, the people who will be more than 6 feet away from us. There's going to be some kicks involved. I need to stretch beforehand. And so, I think, again, there's ways to do things and do it in a really safe way.
I have a question, which is, of course, you are with the state, and obviously guidelines also differ from county to county, municipality to municipality across the state. So tell people a little bit of how that's coordinated, and for them to find out exactly what the restrictions are in their local community. Where do they go?
Yep, I would refer to your local health department. So they're going to be the kind of not necessarily always a final authority, but they will be up to date with what your local guidelines are. And we do expect for and have encouraged local health departments and local elected officials, to do things that they feel is like appropriate for their community. And, even let them know, here are the things that we have found help with the mitigation of risk. And then they, based on their community, because every community is a little bit different, have chosen, different things to do for that. So definitely the local health department. And then I saw it come up to answer some of the questions on that first slide. So if you wouldn't mind, I'll kind of click through that really quick. I tried to answer them as I was walking through, but I probably did miss some. Best practices for patrons entering your establishment. Temperature checks. I think the nice thing about temperature checks is it's kind of a face-to-face for people to attest to the fact that they are feeling well, right? I will say that the temp check things have lots of barriers. One, we actually in the beginning found that when people were doing temp checks of people going into hospitals, those people ended up getting sick, right? Because they get that exposure over and over and over and over to people that potentially have COVID. And so you have to make sure the person doing the temp check is properly, wearing the right PPE. So it has a mask, even a face shield, because they're going to be in people's faces kind of over and over again. Additionally, those temp checks, if you're standing outside in the sun, it's a surface test, right? It's not going into your mouth. It's just on your forehead. So it can be overinflated and show that you have a temperature when really you don't. If you drink a big cup of coffee or you run really quickly, those are other things that might elevate a temperature. And it could also, they will often, show someone doesn't have a temperature when they really do. So it has its benefits, but it definitely has its risks. So I'd have to leave it up to you. The other thing I've seen is that when people are standing in line, especially when they have their masks on, we tend to squish in closer together, right? We have our mask on, we're okay. We don't need to make sure we have that 6 feet of social distancing. And that's just not true. We need to make sure we have that 6 feet of social distancing. So if you're doing temperature checks and that's leading to a big long line where people are potentially exposing each other, then I think at that point, the benefit of doing temp checks is not worth the risk of the exposure while people are standing in line. I think I mentioned the school holiday performances. I mean, I think videotaping, if people are able to keep 6 feet of distance, if they're wearing their masks, those are all things that can happen, especially if you're just kind of videotaping different groups at different times, so they're not all coming together. There are ways to do things, but I definitely would not go to doing what we would typically do of packing an auditorium for a school holiday performance. If you don't feel a venue is following the state guidelines, I would let your local health department know, and they'll know who the right person would be to contact to reach out to that venue or that establishment. I think I talked about what goes into making the colors orange and red. And if you do go to a new color. So if you were orange and then you move to red, then I would just call the local health department and say, do you need me to reapply, or is there any changes that you need to make to my application? I think that'd be an important thing to do. And know that you, again, have to be in the new color for 2 weeks before you would go back to the more expanded restrictions. I did say that the county colors get changed once a week. And so I would have very careful conversations with people who are using your venue, that things could change at a drop of a hat, even a week before the event, and that may prevent them from being able to have it. So I think those are really, careful conversations and considerations, that we just can't predict the future and we don't know where we're going to go. Very rarely do counties go from blue all the way to red. I mean, and if you're following your numbers for your county, you can down, and it'll change at that cadence. So you can kind of see where things are coming and plan accordingly. I talked about the positivity rate being an important statistic because it really tells us of all the people who are looking out to get testing, how many of them end up actually having COVID compared to maybe something else. And then I talked about outdoor events, and I talked about color blindness. So I think I did answer all of the questions.
You're on mute, Lewis.
Thank you. Thank you. Here's an interesting question. Are you concerned with potential spread at the State House after it was announced that legislators will not be mandated to wear masks? And if we're planning to meet with legislators, should we avoid the State House altogether?
Again, I think in every situation, people need to assess their own risk. And we have such wonderful things now that who knew we'd all be so good at Zoom and Teams and all these different avenues of communicating. I do think that, being able to see people's expressions and talking in meetings, like this is very important. And so I think that, utilizing things like this, if you're wanting to talk to your legislator or anybody else in the community, that you can, utilize these types of avenues to do so and do so in a safe manner.
So there are some recent discussions about Ticketmaster developing a component of the ticket buying process to track vaccination or negative test results and the HIPAA considerations. Are there other items venues could consider asking in the ticket buying process?
Yeah, I heard about that. It is very interesting. I think that, the ticket buying often occurs way ahead of time. So I think it really more is that point of entry that really matters. And like I mentioned, even with testing, that you can get tested the week before and be negative, but it doesn't mean that the day that I show up that I don't actually, have COVID and have picked it up in the meantime, or, maybe have even started to have symptoms. So I really think it's that, that point of entry to, remind people, have you been around anybody? Could you potentially have it? Is someone in your household, are they waiting on a result? I can't tell you how many times we hear that. People are like, oh, I felt bad. I went and got tested. And then while I'm waiting for my test, I felt better. So I started going out and about my business. And then it turns out it was actually positive. If you have symptoms and you're getting tested, you need to stay home until you get your results. When we have such high cases like we do now, there can be a little bit longer of a turnaround time. But it is imperative that people, stay home and not expose other people.
Here's a question from the museum standpoint. said at our museum, we were not promoting tours, but we have had some groups reach out to us and we have accommodated their tour requests with everyone wearing masks and limiting to 20 people total and 5 at a time in galleries. Are there other things that you would recommend?
I think when people reach out, I think it's appropriate to share with them the importance of not mixing people from different households or different social bubbles, right? I think just kind of a reminder that that's a high risk situation, even if they're wearing masks, that if they're going to be closer within 6 feet and around each other for greater than 15 minutes, that is a risk. And maybe they could rethink exactly how they might want to do those tours.
Here's a question. Given contact tracing from a public health situation, would there be a time when cultural institutions, if an infection was traced back to a gathering of them, would be asked or required to give patron information out of who was at a venue or seated in a venue, et cetera, et cetera?
I don't want to say never, but it really depends. If you're doing you can do to keep people separated, if you're not having people be within that 6 feet of each other, then the contact tracing really comes from the person who is positive. I would say that the exception is schools, right? So when kiddos are sitting in a certain seat, the school does help with the contact tracing. They know who's been sitting around the kids. So that's a circumstance where we do kind of, ask another entity that's not the positive person or their parents who might be the exposure. But that's really the one instance that I'm aware of. Even with like weddings, for example, they typically talk to the positive person and sometimes they'll say, oh, you need to talk to the bride. I don't know the people that were sitting at my table. And then we'll kind of, have them talk to the bride, get the names and kind of go from there is how that contact tracing process goes.
I am maybe at the end of the questions from the field. I'm going to invite people out there. If there's any last questions, we still have just a couple of minutes of Dr. Weaver's time. So I will just pause here for a second to see if anyone has any final questions. If not, I want to thank Dr. Weaver for joining us today and remind people that we will send out a follow-up to this webinar. It is being recorded, so you can watch it again or invite someone else who missed it to watch it, and it will be on our website. So we will have that available for later viewing as well. Oh, here we go. I have one more. It says our ticketing system automatically incorporates physical distancing, seating requirements, and masks are required when entering our building. What other things are performing arts organizations doing to have live events safely, or what other things would you recommend?
I think really that is the best that you think that you can do, right? It's just to assure that those different groups are separated. And that means it's not just, facing each other. It is that there should be a skipped row behind, me and my group, and that that really the full kind of 6 feet circumferentially is made, and then requiring people to wear masks and reminding them that if they are not actively eating or drinking, that they need to have their mask on. And that it really does help. I think those are the right things to do. I think, I think that's good. Also, just cleaning high touch surfaces. Like I mentioned, we don't believe that you really get it as much from surfaces, but still a possibility if you have a lot of high contact. So handles, doorknobs, railings, those types of things.
Here's one. How can a venue go about being considered to allow 25% capacity, which is in this case 89 people locally allowed, versus the 50 people max allowed by the state? So when those two things don't line up, is there a way to obtain permission?
I would talk to your local health department and submit a plan to them and talk to them about what expectations may be or may be changed, and they will be able to help talk you through that.
And I think I'll go with your one last question, which is what consideration should be taken for performers and crews backstage? So switching your mind from the audience to the performers and crew members, what are your recommendations?
I think it's all of the same things. It's wearing masks, it's social distancing. I think our performers are a lot like athletes, right? And so I think about even my daughter, who is a high school swimmer. As soon as she has her mask on, literally until she's in the water, and it goes right back on as soon as she's out of the water. And that they maintain that social distancing when she is not on or actively swimming her race. And I would expect the same thing from the performers, and definitely people from Backstage need to be wearing their masks at all times as well.
I said that was the last one, but since this one sort of segues into that one, does a gathering that include performers and audience total added together? So in other words, and I've had this question before too, or perhaps a venue that has multiple venues within it.
Yep.
Give some idea of that.
Yeah, so I think that really, again, that is a conversation with your local health department, that if you have a venue that have different rooms that, are each of those considered its own venue, right? Its own space and that's really what the capacities are for, is for your spaces. So likely your local health department would say, yeah, 25 per space or whatever it may be. It's the total number of people. It doesn't matter what they're performing, whether they're a worker or whether they are someone there, to partake, a customer. So I would talk to your local health department, but those numbers are in total.
Well, Dr. Weaver, thank you so much for taking some time to clarify a bunch of things for our sector and to give us some great wisdom. So
great.
Thanks so much. And again, we will see you at another webinar. And please, if you'd like to access this, we will be posting it and following up with an email with where to find it. So thanks so much.
Thank you all. I really appreciate it.